Welcome back. March is Colon Cancer Awareness Month, a cancer that is pretty common, but is also largely preventable and treatable. So today we're talking to Dr. Ross Sage with Bon Secours Gastroenterology. Good to see you. Thank you so much for making me say gastroenterology first thing in the morning.
It's good. It's testing that Furman
Right,
background.
it is. And it is something that you deal with a lot, and we're hearing a lot about it, but it is something that is treatable and preventable, but people need to know some of the signs of what they need to come and see you guys. So let's talk about what are some of the signs that you have something going on?
Sure. So some of these signs may even be overlooked. A lot of these vague symptoms, sometimes patients will complain of changes in their bowel habits.
Yeah.
And that really means I was having a bowel movement every day, but recently I haven't noticed one for maybe 5-6 days, and it's just not what I'm used to.
And is that like a 1 or 2 time thing, or is that like?
It's something that becomes a little more frequent.
Pattern.
If it's a one-time thing, you can kind of get some
could have
idea.
been something you
Right,
ate,
and that's about it. But as far as something that's a little more recurrent, it becomes a red flag.
Okay.
So it's as simple as noticing changes in patterns that you're not used to.
Correct. Whether it's having diarrhea, constipation. One of the bigger things that we talk about too is blood in the stool. The problem is that sometimes this could just be chalked up to some hemorrhoids, but there is a significant uptick in younger folks who are showing, colorectal cancer a lot differently than what it was years back. And because that is a common symptom, rectal bleeding, we want to make sure that that gets evaluated before, God forbid, this potential colorectal cancer becomes more progressed.
Right, and not trying to get too, TMI in the morning, but like when you're talking about blood, are you talking about like a large amount or little droplets?
Or any trace,
Right. So if we see if there's some scant blood when someone wipes, then that isn't always so concerning. We say if this is an ongoing issue, despite maybe managing potential hemorrhoids, say they're using some topical cream and then that goes away, okay, we're good. But if you have ongoing issues despite trying to manage hemorrhoids, then that for sure warrants further evaluation like a colonoscopy or even a good rectal exam in the office, just to make sure there's nothing else being missed.
Should we be aware of is this something that we should concern about our family history when it comes to this, or is this something that everyone's kind of in it together?
Well, it's not one size, fits all.
Right.
Basically, we're all in it together in a sense, but at the same time, not everyone knows their family history.
Right.
There's obviously a large genetic predisposition. And ultimately, the guidelines have moved about 5 years ago from 50 years old to 45. If you have a family history and say they're 55 years old, then you would do 10 years prior to that and start at 45, or or first to 40 years old. So it definitely changes things because once again, you want to catch that cancer on its earlier phase when it can be treated easier and before it progresses.
Yeah, you want prevention, but early detection is
absolutely
the key, right?
Is that why it's so dangerous, you think? Because so many people are not catching it until it's in the later stages?
Well, it's dangerous in that sense, but it's just that there's so many. It's multifactorial to why this occurs. There's so many things involved with that, whether it's the environment, the genetics, a lot of things that just people are overlooking, and certainly the largest thing is diet too. People don't realize how much of an influence that has. Eating too little fiber, high saturated fats, smoking, drinking, the stuff that we usually know are bad habits, and sedentary lifestyle. Obesity in itself is one of the largest risk factors for this.
And I know African American communities, and men especially, have higher rates of this.
They have, yeah. I think right now, though, they are now moving universally to all 45 years old, irrespective of race or sex.
And why do you think we're hearing about more young people getting it?
Well,
or are they? Right? Maybe we just hear.
Oh no, certainly, yeah. There's been since the 1990s. There's been a significant uptick. Now the reason for that is uncertain, but they are chalking it up to a sedentary lifestyle, obesity. So really, that plays a huge role. And so ultimately, to kind of identify an individual risk for developing this is important. One should know the family history. One should be aware of the symptoms that are involved with this earlier on.
So someone that's experiencing symptoms, how do they know when they should maybe immediately get help or come to a gastroenterologist and get more specialized care? How do you know when that time is?
Well, I think if they notice a significant change, a lot of, most individuals will say, I think it's time to at least address this with my PCP. And then from there, they can say, well, they'll check some labs, they'll get a better sense of what's going on, what's been tried, and then get a full history. And then if needed, then they can send a direct referral to our office. I'm at the east side location of Bon Secours, Commonwealth.
Yeah.
And we do direct referrals from the age of 45 to 75. If you don't have any pre-existing cardiac or pulmonary issues, if you're not diabetic or on any blood thinners, they can directly refer them to us for a colonoscopy from the screening standpoint. Diagnostics different. So if you have symptoms, then you obviously are going to be looked at as in a different crowd.
Okay, before we let you go, if you're not having symptoms and you don't have a family history, if you just do that colonoscopy, do you do that every year?
So it's not every year. So a colonoscopy, if you have an adequate prep, you're average risk, you don't have any other family history, then and you don't detect any polyps that are precancerous, you should be good for 10 years.
Oh, good. Okay.
Great information.
Yes, this is really good. Doctor, thank you so
Dr.
much.
Sage.
My pleasure.
All the Bon Secours information right there on your screen. Again, if you're at that age, don't put it off. This is one of those things, people talk about the prep that you have to do the day before, but it's
worth
one
it.
day.
It's worth it.
Save a life.
It's worth it.
Yes, thank you, Doctor.
Thank you so much.
Appreciate it.